Hi, I'm Dr. Chad Larson. Over 22 million people in America suffer from sleep apnea. Sleep apnea is characterized by a lack of oxygen through the airways at night during sleep. And it usually is characterized by very loud snoring. And you'll learn as we go along, as I talk about this, that the more technical term is called obstructive sleep apnea. And I'll get back to the obstructive component because it pertains to what we're going to talk about. But through this obstruction in the airway, there's a lack of proper oxygenation to the system, including the brain. And so it actually becomes a very significant risk factor for lots of things, but a couple of very key things: high blood pressure and stroke. So obviously these are two very important things that clinicians and researchers are very keen to understand more thoroughly and to help mitigate, so people can stop suffering from this really serious and very, very common condition. And so what's known in obstructive sleep apnea is that there's a lack of proper airflow. And so the way that it's treated, and frankly, where most of the research has been around sleep apnea, is into, okay, what can we do to increase more airflow through the airway so the people suffering from this condition can have proper oxygenation. So most of them are prescribed something called a CPAP machine, and it's a continuous positive air pressure, CPAP, and it basically helps to pump air into the system to help kind of bypass the obstruction so they can get proper airflow. And this is really, really important treatment. And the people who could at least tolerate wearing this machine at night actually have a very significant improvement in their sleep apnea score, which is kind of a scoring system that's done in like a sleep center where they could evaluate the airflow and other components of sleep, really improve their sleep quality and quantity. And so it's a really important treatment, but like a lot of things in current clinical medicine, this treatment treats the effect, not the cause. It doesn't do anything about what is the cause of sleep apnea and can something be mitigated there so it can be decreased from the cause standpoint and not just have to treat the effect. And so that made me interested about this study that was just published a few days ago. It's out of the University of Pennsylvania School of Medicine, and it's published just a few days ago in a journal called the American Journal of Respiratory and Critical Care Medicine. And they looked at something interesting. They looked at more the underlying cause and what could be done to mitigate the not only the onset, but treat people who currently have sleep apnea. So they had 67 participants in the study. And what's known about sleep apnea as far as how's a person develop sleep apnea? And there's probably a few different types of sleep apnea, but we know that in general, probably the key risk factor for sleep apnea is obesity. There's been a very clear correlation between obesity and sleep apnea. Not everybody with obesity gets sleep apnea, but there's some other components that need to be considered. And this study kind of talks about a couple things. And so what they looked at is there was 67 participants, all with sleep apnea, and all who had a BMI above 30, which puts them into the obesity range. And if you watch past episodes, you know that I don't really like the BMI. I think it's not perfectly accurate. It probably underestimates people who have too much body fat. And there's other ways like the waist to height ratio that I think is a better test. But anyhow, they used the BMI, and so they all had a BMI above 30, and they all had sleep apnea. And through a variety of different interventions, all the participants lost about 10% of their body weight. And this led to a significant decrease in the sleep apnea scores. So again, through sleep studies, they evaluated airflow and sleep quality and quantity, and some basic measurements that clearly showed that they had improvement, let's say decreased symptoms of their sleep apnea. So losing weight was definitely a key thing, but they took it a step further and they went, okay, we understand that fat burning, losing weight is an important treatment, but why is that? What improved? And so they they did something pretty sophisticated. They evaluated via MRI abdominal fat, and they ran an MRI on the upper airway system, and they looked at upper airway anatomy, and they wanted to find out what changed. And so they evaluated, relative to the decrease of weight loss, of this abdominal weight loss, they also saw a relative decrease in the volume of the key component that they found in the upper airway, which was the tongue. So did you know the tongue actually has fat in it? So that's what they found out, is the greater the degree of loss of fat in the tongue, decreased volume of the tongue, there's a relative improvement or decrease of symptoms of obstructive sleep apnea. So there's an improvement in their sleep apnea as the tongue volume decreased, and that was relative to overall loss of weight. So it was the tongue itself that was the component of the anatomy of the upper airway that led to the greatest degree of sleep apnea. So when the volume of the tongue decreased, then there was a really significant decrease in the sleep apnea score. And so they went on to say that this is hopefully a springboard into further testing of this, and what are some other interventions that can be done clinically and at the research level to help people lose the kind of weight and fat that's necessary to cause the tongue volume to decrease, and so for the sleep apnea to improve. Because if any of you have ever used a CPAP machine, it's not fun. People end up not liking it. It does lead to improvement, and it's an important treatment as kind of the bridge while we're working on the underlying cause, or at least that's how it should be. Right now it's just kind of like, okay, here's your CPAP, good luck, and you're gonna be using that the rest of your life, and because you're gonna have sleep, there's no treatment for sleep apnea, in other words. But now we know that there is. If you can decrease body weight, we've talked in a lot of episodes about fat burning, and this leads to a decrease in volume of the tongue, and that'll decrease the symptoms of the sleep apnea. So hopefully this is something that is interesting and you learn something. I will keep reading the studies and bringing you the information. Until then, keep it real.